My name is Katie. I am a registered nurse. I've worked on a med surg floor. I've also spent a lot of time in the operating room. For the last 2 years, I have worked here at Fusion on the clinical team as a clinical liaison. Sadly, I think you would be very hard pressed to find a nurse or any healthcare worker who has not experienced some type of workplace hostility. A lot of that is due to the nature of the work that we do. We are dealing with very high stakes, and the environment that you work in is going to be emotionally charged, very stressful. That said, I would say that doesn't make it right, doesn't make it easier. And I know that at Fusion, anyway, we're really focused on supporting our nurses and travelers who might be going through that kind of an experience. At Fusion, we are very aware that this is a problem that's facing our healthcare workers right now. We have a clinical team that's comprised of wonderful nurses, and these nurses are able to and happy to talk to travelers about any of these challenges that might arise. Our company has also made a lot of relationships, inroads with wonderful non-for-profits who are very focused on improving the lives of healthcare workers, such as Operation Happy Nurse. And many of these organizations have free mental health resources that are available to our healthcare workers. And overall, Fusion is a company that's just very genuinely focused on all of its employees and seeing our employees succeed. That includes our travelers. And so any person that you come into contact with at Fusion and interact with is going to be someone who is focused on seeing you succeed and will prioritize your mental health and prioritize your safety while you're on assignment. Having been in similar situations like this myself and anyone on our team, we have a fundamental understanding of the challenges that a healthcare worker might be facing. And I would want any traveler who reaches out to us, either directly or through their recruiter, we would want them to know that they're talking to someone who genuinely understands what they are going through and is going to meet them with compassion and understanding. My advice for a healthcare worker that's experiencing a hostile environment, or really anyone that's experiencing something like this, would be to document, whether that is in the patient chart or that is for your own personal records. I would also say to not be afraid to escalate something, whether that be to your manager or supervisor on the assignment or through your recruiter and the clinical team here at Fusion. Escalate any problems that occur. And I would also say one final thing would be to just be vigilant of your own mental health and self-care, and not be afraid to advocate for, taking some time for yourself and prioritizing yourself. When you're choosing Fusion, you are choosing a team of people who are going to support you every step of the way. We want to celebrate with you when you're having an amazing adventure, and we also want to support you when you are facing any challenges that might arise on assignment. Our core mission at Fusion is that everyone that we touch will have a better life, and we know that the only way that we can achieve that is through the hard work of all of the healthcare travelers that are out there doing what they do best. And it is our job here to ensure that they have all of the tools and support that they need to do just that. I would like to end by just saying thank you. Thank you to our travelers who are out there doing wonderful work, doing hard work. Healthcare worker to healthcare worker, it really means a lot.